Hi, everyone. This is Dr. Jay Cotton, and he's going to be interviewing with us today. Um, can you just identify your credentials and workplace, state, city, place, and yeah,
Yes, I'm Jake Cotton. I'm a surgery resident in Colorado. I have a medical degree from the University of Central Florida, and I practice in Denver, Colorado.
awesome. And what is the minimum education necessary for your certification and licensure?
Yeah, so you have to have an undergraduate degree, and then you can go into medical school, and that's 4 years. And then after medical school, you have to complete training for general surgery. You have to do 5 years of residency. And then after residency, if you want to further subspecialize, you can be fellowship trained in whatever surgical subspecialty.
Got it. Okay. And how did your clinical experiences work when you were at school? Did you do like education and training, or was it like you first did your education and then you did like your clinical hours?
Yeah, so in medical school, you do well, previously it's since changed, but when I went through medical school, you did 2 years of didactics or classroom training,
Mhm.
and then that was followed by 2 years of clinical rotations. There are some clinical rotations during the first 2 years of medical school, but the vast majority, probably 90 to 95% of your time is in the classroom.
Got it. Um, can you practice as soon as you graduate and you pass your boards, or do you have to go through some further steps?
You have to complete a residency training in order to practice. Not all residencies are as long as general surgery, and there
Mhm.
are some that are longer, but in order to like be an independently practicing physician, you need to have residency training completed.
Got it. So after you graduate residency, can you just go out and get a job anywhere?
Yes.
Okay. Um, all right. And according to your practice act, to whom do you answer to? Do you have somebody that you answer to? I mean, obviously probably right now, but I guess after residency too.
Yeah, so I guess all that depends what kind of setting you work in. Um there's always going to well in a hospital based setting, there's always going to be a senior partner, I guess, that you would answer to until you become that senior partner. In a practice based setting, like if you're in a primary care, um, whoever the managing uh, physicians are would be the person that you answer to.
Got it.
And then if you go out on your own and you're practicing independently, I guess you answer yourself.
Yeah. You're the boss.
Yeah.
Okay. And can you describe the national license registration and certification process? So basically, I'm just going to go through a few questions on that.
Okay.
How often do you need to renew this?
Yeah. Great question. I'm not completely sure. I think it's to be board certified in surgery after you pass your initial boards after training. To remain board certified, you can retest every 7 years.
Oh, okay. So you have to take a test every 7 years.
You, in order to stay board certified.
Got it.
You don't have to be board certified, but if you choose to be board certified, it's every 7 years.
Got it. And how do you do this? Like, do you guys pay a fee? Do you guys have CEUs that you need to complete each year?
Yeah, so there's a test you can take. So you pay a fee, take a test, and if you pass, you're board certified.
Got it. And do you have to do like CEUs to like get any
I
certification?
don't think so. I'm not entirely sure, but I don't think you're required to do CEUs.
Got it. And I'm not sure if you know the answer to this question, but how expensive is this license registration or anything like, I don't know if you have to apply to like the state or like nationally. We'll just
Yeah,
talk about national first, but um,
yeah.
like,
So the American Board of Surgery test, I'm not exactly sure. Um, let's see if I can find it real quick. Uh, $550
and is that every year? Or you said like every 7 years.
every 7 years.
Got it. So now we're gonna go into like your state regulation. So I guess in the state of Colorado. So how often do you need to get like some sort of certification in the state of like Colorado to practice?
Yes, you have to be registered through, I think it's like the Department of Health or something in the state of Colorado. And yeah, there's some fee associated with that. I don't know what it is. It was waived during COVID.
Oh, that's nice.
Yeah.
And do you know, like for this, do you have to do any CUs or anything like that?
No CEUs for that.
And then do you know if it's annually or is it
I think it's every 3 years because I just had to renew it.
got it,
And I renewed it. I got my initial one 3 years ago.
got it. And when you renewed it, was there a fee associated with that?
It was waived for COVID.
Got it.
It was free this year.
The only reason why they ask that is because like as an athletic trainer, we have like we have to get like a licensure and we have to get a certification. So it's like we apply to like the cert first and then you do your licensure in your state. So it's like you have to do two processes.
Yes.
And do you need to submit anything else with each renewal? Like, do you need to do like obviously you probably have to be like CPR certified, but do you have to like send that in or show anybody anything?
I don't think you have to send that in to be registered with the state. But anywhere that you're employed is going to want your, BLS or CPR AD, your advanced cardiac life support. And then for surgery, you have to take ATLS, advanced traumatic life support.
Got it. And all right. Do people with your healthcare credentials work with athletic trainers, and in what capacity? In what capacity, and if not, why?
Yeah. So currently, I don't interact with with athletic trainers. There are people who are not in surgery, probably like orthopedic surgeons, not in general surgery, but orthopedic surgeons or family medicine that might interact more so with athletic trainers.
Got it. Yeah, well, definitely for the orthopedics. At your current workplace, what is the title, degree, and credential of the person that supervises you?
Yeah, so changes from rotation to rotation. But most of the time they're attending surgeons. They all have medical degrees. Some of them will have master's degrees in various fields like master's of clinical science, master's of public health, master's of business administration. And they're all attending surgeons.
Got it. This is a good question for you. What are you currently doing to assure you have a good work-life balance?
Well, right now my work-life balance is better than it is during clinical years. But just when I get home, making sure I make time for my family, go out and do something at least every other week, dedicate at least half a day to doing something with them. And then beyond that, I guess just being present when they want me to be places.
Yeah. And I'm sure when you go into rotation, it's very hard.
Yes.
You're working a lot. The next question is, what are some specific leadership traits and behaviors that work best in your profession or work setting?
Yeah, I would say there's a lot of people on a healthcare team. So just listening to everyone and making sure you take everyone's opinion into consideration when you're making a decision. Especially, like one of the biggest things is when you're like probably displaying leadership qualities the most is during like a resuscitation. Just making sure you're listening to everyone who may have been with the patient prior to the emergency. So whether that be like pre-hospital healthcare providers, when they bring a patient into the emergency department, or in the hospital on the floor, or in an ICU, the bedside nurse who's been with the patient all day, what they've noticed leading up to the emergency, respiratory therapy, just making sure you have open communication, I think is super important as you lead a resuscitation.
Got it. Definitely. And we're learning a lot about like leadership styles right now. And, in my profession, I would say I'm more of like a peacemaker. I'm trying to make people happy, but also, working on like communication, all that type of stuff. So what would you say that your leadership style is?
Yeah. It's funny you mentioned that because someone said to me a couple of years ago, they're like, you're going to have to choose the kind of surgery chief that you are. But I think just keeping keeping it like an almost like informal conversation almost. Like if you walk into a room and you're kind of demanding or you just have a bad tone, I think it will make people more like hesitant to speak up. So if you kind of speak informally and say, you know, what does everyone think? Checking in, I think, is huge.
Mhm.
Just kind of summarizing and saying, does anyone else have any other ideas? I've gotten great ideas from, you know, because in these resuscitations, there could be like 15 people in the room, everyone's doing their own thing. So
Yeah.
just checking in, seeing what ideas other people have and keeping it an informal tone so people are kind of at ease and willing to speak up, I found most effective.
Yeah, that's awesome. Well, that was all the questions. So I appreciate you taking your time to come talk with me today. And I'm gonna stop this Zoom recording.
Yeah, of course.